I don't really need to tell this crowd, I don't think, how bad the Affordable Care Act is. Most of us wake up in the morning and go to sleep at night thinking about that particular issue. There are a couple of things we're going to have to do, and I'll talk about it in a little bit more detail, but I can summarize it in a couple of points. First of all, the Affordable Care Act focuses almost entirely on the demand side, and David said this in a number of ways, that it's the buying power that's going to change things, completely ignoring the supply side. However, I will say that most of the free market advocates, including at times Michael and me and others, have focused also on that demand side, and we need to look far more at what is the supply side, what determines what gets produced, products that no one even knows about yet. Another point that I'm going to focus on in my work is I believe, in all honesty, I teach mostly mid-career healthcare professionals, doctors, nurses, therapists, administrators, you name it. And I will tell you this, after teaching graduate, the doctoral and master's level for 15 years, quietly, inexorably, that whole industry is sliding to the left, toward statism, toward collectivism, toward a resignation of, I give up, let the government tell me what to do, write me a check twice a month, and I'll be here between 9 and 5, done. And it worries me to death. But that is a community we have to reach. We have to reach the healthcare professionals, in particular the doctors, because they have a huge multiplier effect. How many people out there say, I was talking to my doctor who told me things are great over in England and France and up in Canada, so yeah, let's let the government take over. Huge multiplier effect. I would go so far as to say that getting the medical profession back looking at markets and thinking about them is a necessary condition for winning this battle of ideas. It is also pretty close to being a sufficient solution. If we get to them, we win the battle. We win the war about it. And we're losing it now. And so that's going to be a lot of my emphasis. Now, how do we go about that? And David's book is fantastic for revealing things, and I'll get to that in a little bit. But I'm convinced that to be a statist, to be a collectivist, to think that command and control is the way to go, government-centered healthcare, you have to have an almost religious faith in the sanctity of data, in the infallibility of economic modeling, in the pure altruism of politicians, the near omnipotence of bureaucrats to shape and mold and fine-tune the behavior of 310 million Americans. I don't believe in those things, but a lot of people have slipped into that belief, including a lot of my absolutely brilliant students who I would trust with my life on the operating table any day, but they are being led in that direction and leading themselves there. On the other hand, conservatives, libertarians, other market advocates, including some on the liberal end, have not offered adequate solutions. Again, and when I say adequate, let me say persuasive, convincing solutions. Solutions that work outside of our own little bubble here, that we can all, I can tell you markets, and you'll all say, yes, that's the way to do it. Let's go for markets. Well, that's convincing to us because we've sort of attuned ourselves to thinking that way. It's not convincing to a lot of people. And I guess what really strikes me with a lot of the doctors and nurses in my class is I get a lot of people who, by and large, are very, very sympathetic to free markets in practically everything other than healthcare. And they believe there's a law of physics that marks a wall there that says markets work over here, but not over here. Let the government do it there. That's the argument we are in the process of losing. That's the argument that we have to win back. So a lot of this is both coming up with substance. How do we address, again, that supply side? And secondly, how do we message it? And I'll add that I think a lot of the things that we have to advocate, a lot of the reforms that have to come out must be simultaneous. We're going to have to reform the Medicare reimbursement formula, which figures so prominently in David's book. We're going to have to fix insurance markets, tax, and very importantly, we're going to have to focus heavily on state regulations, which is sort of what keeps us in, to use David's terminology, and I often use it myself, a mainframe medical care rather than moving us to the laptop and smartphone health care that he was talking about. we have to message it in a way that makes sense. Again, the word markets just doesn't do it for a lot of people who are winnable, who are attainable for these arguments. So lately I've been personalizing. I've been asking a question, and it's interesting because I'll get stares of, that's an interesting question, when I simply ask, why is there no Steve Jobs anywhere in healthcare? Someone who comes in from the shadows that you've never heard of, shows us a way to make prices plunge, and shortly thereafter to see quality rising to unimagined heights, leading us into new products, new innovations that we've never even thought about, that we never knew we wanted. No one knew when that deck came out that they wanted a smartphone. Let's say very few. There were one or two out there, but not many. So where is Steve Jobs for healthcare? Where is Bill Gates, Jeff Bezos, Elon Musk? If you want to go back a little bit, Henry Ford. And for me, the answer is that we have structured the healthcare industry in such a way that such people cannot exist. And that I would interpret as really the main thrust of David's book. We have built a legal structure, a regulatory structure, an institutional structure, and sort of a political culture of insiderism, insider power that assures that cannot happen in healthcare. That is what we need to change.